Hi guys, welcome to today's episode of Helping You Keep Your Mouth Clean. It's your favorite dentist, Dr. B, today. So you're welcome. And our topic today will be about pregnancy and your mouth. And people will be like, what's the relationship between pregnancy and the dentist again? She has come again. Yes, it's very important. You don't just get pregnant and give birth and don't visit your dentist. No. So you start involving your dentist right from when you are planning pregnancy. I know that some people, they have unplanned pregnancies, like they were not planning to get pregnant when they got pregnant. They just got pregnant out of the blues. Some just got married and got pregnant out of the blues. But me, I feel every pregnancy is planned. As soon as you have unprotected intercourse, that pregnancy is planned. So I don't like taking that excuse of it wasn't planned, we're not expecting a baby and all that. So start preparing for your teeth before getting pregnant, so that you have a stress-free pregnancy. Imagine that pregnancy where you have to actually think so much about dental visits. Yes, but it's not when dental issues come when you're pregnant, you can't help but visit a dentist because sometimes you have mad pain, really mad pain. So do you want to wait till you have mad pain before you start planning your teeth towards pregnancy? Now we are trying to get pregnant, to see your dentist. Even if you do not do anything, wash your teeth. Remove the existing plaque and calculus on your teeth. Remove them. Have them professionally removed by doing scaling and polishing. Then when you are done with that, you have a thorough dental examination. Is there a teeth with a hole? Fill it. Is there this one that's about to be lost? Remove it. Whatever kind of treatment you need to do for your teeth, try and optimize your dental health before pregnancy. I know some will say, why is this doctor disturbing us again? Oh, this dentist has come again. She wants you to visit dental clinic for every situation. She wants you to always visit dental clinic. You will thank me later. If you practice it, you will thank me later. It's just as simple as that. It is very simple. When you optimize your mouth before pregnancy, you have a smooth pregnancy without a single need to visit your dentist for that 9 months. Yes, you can have a very smooth pregnancy like that. You don't need to visit your dentist while pregnant if you did your pre-pregnancy checkup properly. You have your mouth optimized before pregnancy. Now, some other people will be feeling, there's nothing, it's not pregnancy, we get pregnant, we give birth every day, it's normal, and I don't know why this person is so concerned about it. Don't forget that some people have cravings in pregnancy. Some people have cravings in pregnancy. Some of their cravings are sugar. Some people crave sour foods. Some people crave sugary foods. So if you're in the group of people that crave sugary foods, imagine if you had a hole in your teeth before you had a caries that was already so bad and close to the pulp, and then you're craving so much sugar in pregnancy and you're just taking so much of them, and maybe you're not even brushing well and all that, you will come down with pain. You will come down with pain. So that's why it's good to see your dentist before pregnancy. If you take care of those things before pregnancy, during your pregnancy, you can actually have a complete pregnancy without visiting your dentist. Now, because of those cravings, some people eat anything. Some people can wake up in the middle of the night because of pregnancy and take sugary drinks. Even after brushing their teeth in the night, they can wake up and just bathe their mouth in sugar. That's how bad it can be. That's for cravings. So you don't know what your cravings will look like. You can't predict it. Some people say, "Oh, I've been pregnant before." Lie. First pregnancy, second pregnancy, they are different. So try and see your dentist, because you don't know what your cravings are going to be like. You know, your cravings are going to be the type that you won't even feel. In fact, some people, I won't call it a craving, but some people will tell you in their last pregnancy, they couldn't even brush their teeth. They were that lazy. They could not even get up of their bed. They were that weak. Yes, that's how some people so guys. So now, some other thing we'll be considering is vomiting. So people for the first trimester or even up to the second trimester, they keep vomiting. Nausea and vomiting is just their thing, despite medications. In fact, some people were placed on antiemetics just because of vomiting in pregnancy. So we will be admitted in the hospital. Some of them cannot even retain food. It will be so bad that they'll be on infusion, but they will still be vomiting. And that thing you are vomiting from your stomach back to your mouth is acidic. So your teeth does not like acid. Your mouth will smell. Now imagine that mouth that was bad before pregnancy. Please see your dentist before you get pregnant. Please see your dentist before you get pregnant. Just try, so that you just have a pregnancy that you did not have much need to be in the dental clinic. So some will vomit and all those things. Those things can cause mouth odor. They can erode your teeth. The acidity can erode your teeth. Some of you, in fact, it can be very bad for some people. Some people cannot eat. Some people cannot even brush. Yes, there is deficiency in cleaning in some people. Some people, when they are pregnant, oh my God, if you see their teeth, calculus everywhere. They'll tell you that as soon as toothbrush enters their mouth, they are vomiting. And for those who vomit excessively, they do anything possible to make sure that they are not vomiting. So if it means not brushing, they will not brush their teeth. Now, if their mouth was not fairly clean before pregnancy, you know that it will be worse during pregnancy. You can start having that kind of mouth odor that will drive your spouse away, your partner away, or even the people just living around you. It can actually be can be that repulsive. So take care of your teeth before you get pregnant. We've talked about cravings, we've talked about deficiency in cleaning of the teeth during pregnancy, and then acidic regurgitation and vomiting. So those are not good, they are not healthy for your teeth at all. So it's good for you to optimize your mouth prior to pregnancy. And if you're experiencing any of these, if you're experiencing hyperemesis, you are vomiting too much, craving too much of sugary things, or you can't even clean your mouth well, you can still see the dentist during pregnancy. But like I said, it's best you plan optimum dental health prior to pregnancy. But even if you are pregnant and you notice that you're having all these, or you have had issues in your teeth prior to pregnancy and it's getting worse in pregnancy, you can still see your dentist. But please, do not stay at home. There are some don'ts. Please, do not stay at home as a pregnant woman and you're having toothache and you're taking self-medication, prescribing for yourself, or you're doing random home remedies. Please don't do that. Don't just take anything that has been working for you. Some people will say, oh, they've had it before, they took NC, they took analgesics, they took pain relief. There are some analgesics that you cannot take at certain stages in your pregnancy. So do not practice self-medication when you are pregnant, especially as regards for toothache. Or there are some people who tell you when they're having toothache, they pour acid, some say they pour fuel, some say different things, some say alcohol. Please don't do all that when you're pregnant. Please, please, please. That's why I'm saying optimize. Prevention is better than cure. We all know that. Prevention is cheaper and better than cure. So if you can, see a dentist before you get pregnant. If you actually, when you are aware, oh, I'm getting married and I'm not ready to do any form of contraception, the moment you're having sex and you're not ready for contraception, please see your dentist, because you can actually get pregnant at any point in time. So see your dentist. Another thing that pregnant women experience is bleeding gums. Yes, because of the hormones that are much in your body, especially the progesterone, you can have bleeding gum. You can brush your teeth and still be having mouth odor. This is because your gum has tendency, the blood vessels in your gum are dilating, there's tendency for it to bleed easily. So those are one of the things that happen in pregnancy. So in a previously dirty mouth, to be worse. The bleeding gum, in fact, when there is plantar calculus in your mouth, the bleeding will be worse, most likely going to be worse. There's another kind of tumor, a benign tumor that appears in the mouth from poor hygiene, from presence of deposits in the teeth. Now, in pregnancy, it is more common. When you have lots of accumulations like that, in pregnancy, you may just come down with that pregnancy tumor that is in the gum of the individual, and some become so anxious. Imagine adding to the stress of pregnancy, having a growth that you have to excise and then do a biopsy for, and then histopathology. Like it doesn't really go well for some people. Not that it's malignant. No, it's not really malignant, but just the anxiety of having a growth, a tumor in the mouth, is enough to make some people to be very anxious. It's just the fact, knowing that you have a growth in the mouth is enough to make some people anxious. So you have to just make effort to optimize your dental health, so you don't have to be suffering with a growth during pregnancy. You know the stress of pregnancy, and then you're adding a tumor to it, and it's just from poor oral hygiene, though, just from dirty mouth. It's not worth it. Like, it's so unnecessary. So unnecessary for you to be going through all that stress. Another thing you can do when you're pregnant, I know some people say it's very difficult for them to brush when they are pregnant because of the nausea and then the subsequent vomiting and all that. Please try and brush twice a day, even if it is just the teeth, even if it is just with your mouth wash. Anything you can do, try and make sure that twice a day you keep your mouth clean. So pregnancy is not an excuse for you to irritate your partner, and then you don't know how your pregnancy will turn out for you. So are you newly married, or you just had a child? In fact, when you are having unprotected intercourse, please go and see your dentist so you don't have a stressful pregnancy. I'm just encouraging you to having a stress-free pregnancy. So it's your favorite dentist, Dr. B. So try see your dentist before you get pregnant. And when you're pregnant and you have issues with your teeth, try as much as possible to see your dentist. That's all for today. So don't forget to click the like button, subscribe, and turn on your notifications.